Let us talk about how to assess a colon flat lesion before you undertake endoscopic mucosal resection or endoscopic submucosal dissection. Three important features. You look at the surface for features of cancer. Next, you look at the edge for any skirt lesion, and then you look at the position of the lesion, whether it is dependent or not. Let's talk about these features in detail. When it comes to surface, looking for cancer, you should use preferably a cap-fitted colonoscope, high-definition scope with chromoendoscopy features, and if possible, a near-focus function, and scan the entire surface of the lesion, looking for surface pit pattern and vascular pattern indicative of submucosal cancer. If you find those, this lesion is not amenable for curative endoscopic resection. On the other hand, if you don't find features of cancer, you can go ahead and do endoscopic resection. Next, let's talk about the assessment of the edge of the lesion for skirt lesion. And what is a skirt lesion? So when you look at this picture, the obvious finding is that the edge is somewhere here, and the polyp extends from here to here. But in reality, because of the subtle area of tumor tissue that is skirting around the polyp, otherwise called the skirt lesion, extends far beyond what you thought is obvious. Unless you take into consideration and include in your resection the skirt lesion as well, you are likely to end up with recurrence. So to avoid recurrence, you should carefully examine the edge of the lesion and look for whether there is any skirt lesion or not, and if it is, make sure you include that in your resection. Next, we look at the position of the lesion in relation to gravity, whether it is dependent or not. If it is dependent, and if you resect, and if there were to be bleeding, it will be very hard to find that bleeding spot as the blood pools in there and you cannot find the arterial spurter. So in order to avoid this problem, before you start the resection, you spray saline with methylene blue or indigo carmine and see where the fluid puddles. If the lesion is not dependent, the fluid moves away to the other wall. And if that is the case, you could go ahead and do the resection, and bleeding can be easily seen and taken care of. On the other hand, when the fluid puddles around, that means the lesion is dependent, and you should change the position of the patient so that if bleeding were to occur, you could easily find that. I hope this explanation is useful. Thank you.